Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Welcome back. Good morning to those that are joining us now. Welcome back to those that were with us on the past half hour. And our guest this morning, Ina, is Dr. Massi Benzid.
Yes.
Is that correct?
Yes, correct. Massi
Okay.
Benzid.
And Massi, you are one of the dentists that work at AGI, and we want to officially welcome you to the family of AGI.
Thank you. Thank you very much.
And
My
I want
pleasure.
to thank you for coming and educating the audience on dentistry and what is dentistry. Let's start with why you became a dentist. What motivated you to become a dentist?
Well, I've always liked science and health sciences specifically. But I was not really interested in having a lab job. I did my undergrad in biomedical sciences, but I was always interested in being in touch with patients.
So you are a people person,
Yes,
Okay.
exactly. And I like to work with my hands also. So
like a true Canadian.
Yes, absolutely.
Yeah.
So I think it suited me well in many regards, as
What
far
part
as
of Canada are you from?
I'm from Montreal,
Montreal.
Quebec, Canada.
So you
Yes.
speak French.
Yes, absolutely. My first language, actually.
Just first language.
Yes.
That's why you hear the accent, the French accent.
Yeah, it's still there.
Yeah. And so I suppose that a lot of the Canadians, when they come to South Florida, they would love to be able to see somebody that can not only, speak their language if they have a language barrier. And that's so important for the patient.
Yes, absolutely. We have a lot of snowbirds
Yes.
down here in South Florida. I have several patients that are French Canadian, and even Canadians in general. If you're looking for a dentist down here in Florida.
Yeah. But let's talk about dentistry. A lot of people start losing their teeth. And in my years of experience in medicine, Massi, I tell you, if a person loses teeth in their back, they are not so concerned. They feel that that's okay because nobody's going to see that.
Correct.
If they lose it in the front, they go running to you.
Absolutely.
You got to do something. You got to do something.
Absolutely. Yes.
But what are the consequences of a person once you lose one tooth? Are the mouth is going to stay on the same position, or are the teeth going to start migrating? Are we going to be able to do something 6 months from now, a year from now, 10 years from now?
Well, yeah, it is a problem, like you mentioned, even if it's a posterior tooth, for many reasons. And as far as how long it should be, how long after an extraction it should be taken care of, as soon as possible, obviously, because many things can happen. Yes, your teeth can shift. It can affect your bite. If you have a malocclusion, which means a problem with your bite, it can affect your joint. You can have temporomandibular disorders coming from that. Also, mastication. As an internist and a geriatric doctor, you know that mastication is very important. And posterior teeth, back teeth, are very important for mastication. Front teeth are not really designed to chew. Okay, it's more to tear your food. But the mastication is done by molars and in part by premolars also.
So the teeth that are all the way in the back, they are the one that
Absolutely. They take most of the pressure, actually. If you measure the pressure that's put on different teeth, there's more pressure towards the back because it's like a lever. So at the back, it's closer to your joint, and there's more pressure there.
and the pressure is supposed to be around 400. And if a person have denture, it drop down to about 5 or 10, something like that. So people don't
Yes.
appreciate the
Absolutely. There's nothing like your real teeth.
Like
So,
your real teeth.
yes, whenever your dentist can save a tooth, it's
Or-
always preferable.
or implants, right?
Yes,
Or- yeah,
implants
they
is
have-
a good option. If
Yeah.
you're a good candidate, then we
Because
can
they have
advise
those
you on that.
denture implants now that give you basically stronger bite when you
Oh, yeah.
chew the food.
Oh, yeah, it helps a lot.
Right.
There's a big difference with regular dentures.
So if a person, well, nowadays, one of the things that we are doing at AGI Dental and Medical is if a person is having an extraction and it's elective, there's no infection or anything like that. They can even do the implant right after the extraction on the same day procedure, which is great. I mean, that means you don't allow any room for the for any migration of the neighboring tooth.
Yes, as well as bone resorption, because immediately after an extraction, the alveolar bone, which means the bone around the roots of your teeth, start to basically melt, resorb, because there's no more reason for that bone to be there. So basically, it just starts to contract, to shrink. So you lose bone starting immediately after an extraction. It's part of the healing process. So having an implant immediately, or having a bone graft, which we do fairly often, like you said, when there's no infection, helps a lot to maintain the bone level.
And people don't appreciate that when the dentists are talking to them. They say, "Oh, what do I need a bone graft?" And if you get an extraction, especially in front of your mouth, and they don't do the bone graft, and the bone reabsorption take place, you have that gap now. Even if they put a bridge in there,
yes, it can be in space underneath.
It can be space. It doesn't look right.
It doesn't look right.
And then they go back blaming the dentist. And you have to, that's what the bone graft becomes so important to preserve the anatomy of the mouth.
Absolutely. Yeah. And even without even smiling, even if you see someone's profile, when someone loses their front teeth and you see them from the sideways, you see the lip support is completely different.
Exactly.
It's completely different.
And that's why in previous program that we have done with your dental department, that's one of the things we have brought up, because I do aesthetics. So I do a lot of, wrinkles and stuff like that. And people sometimes they ask me why one side of my face is more wrinkled than the other side, especially around, the mouth area.
Yes.
And basically, if you have lost teeth on one side, the reabsorption take place, the shifting, the jaw moves, so you don't have that symmetry anymore.
Yes, absolutely.
Unless you go and take a tooth on the other side, prophylactic.
Yes. That would be one option. Yes, not advisable.
That would be a bad option.
Absolutely.
So, Massi, I know you did a fellowship in oral maxillary facial surgery. And, I'm so proud to have, somebody of your caliber at the practice. But let's educate the audience. What does that intend to do this fellowship? What is the training that you have to go through to become an oromaxillary surgeon in dentistry?
Well, oral and maxillofacial surgery is a specialty of dentistry. But it also has a lot of subspecialties. So it entails a lot of things. Some of them are done in a private practice setting, like we do. Others are more hospital-based. So I had the experience in a lot of them.
In both of them, right? Because you're in the clinic, seeing patients, and you also at the hospital you work.
Exactly.
And you work in emergency room.
Exactly.
So you're going to be my emergency dentist, my go-to for emergency.
Yes, absolutely. And we're also very well trained in dealing with people with medical conditions. We had a lot of patients with multiple, whether it's diabetes, high blood pressure, heart problems, kidney failure, liver problems. We were used to working with a lot of these patients.
So you've been exposed to all of those.
Exactly. So we know when we need to check with your other specialists before we do a procedure, when it's safe. We're more trained in the medical aspect. Within the medical field. Yes, dentistry within the medical field.
Which is great, because a lot of people think, dentists, they only have to do with your mouth.
Yes, no, everything is connected. Absolutely.
Mouth attached to somebody.
Absolutely.
Excellent. So during your training, so I suppose then you were able to deal with trauma, a lot of trauma, and you did your training in Louisiana?
Yes, exactly, yes. We had a lot of trauma in southern Louisiana, a lot of trauma calls. It can go from a chipped tooth to just a fracture in the mouth, teeth and bone in the mouth, to major cases, car accidents, mandible fractures, the most common facial fracture, and others, maxillary, nasal, everything.
Dr. Benzid, let me ask you, sometimes, we are at home, and especially my elderly patient, and younger patient that, we fall down, we hit the cabinet, and we hit right on the mouth area. And we feel that the tooth are maybe a little bit loose, or that we have maybe fractured something or no. And we say, should I, Saturday morning, should I go ahead and just wait until next week and see when my dentist can see me? Or should I try to go and see Dr. Massi because this might be a dental emergency? What is the take on that? Because a lot of people get hit or fall down and hit their mouth. And if they see that not to have fallen, that everything is okay.
Yes.
Give us some feedback.
Well, each case is different, but when in doubt, it's preferable to seek your dentist's advice right away. At least if something has to be done, it's preferable if it's done right away.
And
whether
that's
it's
true. Yeah.
Yeah, whether it's a root canal, whether it's an extraction, or even if it's not that bad and the teeth just need to be splinted, basically attached together.
So that we can preserve.
Exactly, so we can keep the tooth. Because even if it's a slight movement of the tooth, even that slight movement can lead to complications. Because, for example, when it's moving a little bit, there's a little space in the ligament where bacteria in your saliva can infiltrate and cause an infection, just because the tooth is moving a little bit. So if that's the case, it would need to be done right away. And if it's something worse, if the tooth is dead, it might need a root canal or an extraction. Yes.
And a possible implant before, So it's important to get seen for, because it becomes an emergency, any facial trauma. And that's Dr. Benzid basically specialty. Any facial trauma, it's important to get seen. And I see a lot of facial trauma in the center. I'm so proud now having Dr. Benzid with me, that we can work together to better serve the community. But a lot of time with facial trauma, you get those hematoma around the face, which is blood accumulation. And it might be very benign, like Dr. Benzid said, but it can be when we get those raccoon eye, it could be an indication that you have traumatized also the base of the brain. So it's important that we don't neglect that regardless of one's age. And a lot of times the hematoma, the worst thing to do is just to do nothing. When you have a hematoma on the face, put warm compressor. Moist heat is the best thing. The first thing that is going to happen, I always tell my patient, is going to look worse before it goes away. Because what's going to happen, the blood is going to start spreading throughout your face, and it might come even down into your neck. But once you spread the blood, the body can reabsorb that blood and take it back into the system. Why don't we give the phone number and address for Dr. Massi Benzid, our guest of the day?
Yes, the phone number for Boynton office is 561-270-6494, and it's located at 12453 Hagen Range Road, Boynton Beach, Florida. Zip code is 33437. And the phone number for Fort Lauderdale office is 954-489-1345, and we are located conveniently on East Commercial Boulevard, right behind Holy Cross Hospital. And you can visit us on our website, www.agifl.com.
Excellent. And we are open today, Saturday. Again, we do open for emergency, but we are open for patients that are scheduled to be seen. And if you want to set up an appointment with Dr. Massi, just call any of the office, and you can request him by name, and we'll be happy to accommodate for you. Dr. Massi, so tell me about a simple thing. How important is for you your hygienist? How your hygienist can assist your patient in preservation of their oral care?
Well, very important, because basically you have to see your gums and the bone surrounding your gums as the foundation. Okay, basically, if you invest in saving your teeth, like we talked about earlier, you can't build, basically what the example I give is, you can't build an expensive house on mud, basically. If the foundation is not strong, it's useless. So even if your tooth is healthy, even if your tooth has no decay, but the bone around it is soft, whether it has you don't have enough quantity, or the quality is not good, or your gums are inflamed and they start to abscess, then it's all for nothing. Basically, your tooth is not worth much without the bone and the gums supporting it. So the hygienist is doing a very important job in that regard, because they can help you improve your periodont, your gums and the bone around the teeth, and then maintain it. Okay. So when we assess the patient, we give them a first cleaning, whether it's a regular cleaning, intermediate cleaning, or sometimes a deep cleaning. And then she helps you create a program to maintain the progress that was made. Okay, otherwise it can go back to square one. Okay, so it's important to maintain, and sometimes with the use of antibiotics or certain instruments, you can sometimes save a tooth that was otherwise, planned to be extracted.
And unfortunately, people don't see the hygienist frequently enough. They wait until they start getting some symptom when they're drinking cold and they get sensation. They drink hot and they get sensation. The hygienist is one of the most important person in my eyes when it comes to prevention.
Yes.
Because they are the one that, like you said, they work on that structure, that base,
Exactly.
the foundation that we have for preserving our teeth in place.
Yes, creating a program that suits you, because, for example, some people need a recall every 6 months, but some people need a recall every 2 months because they accumulate buildup more easily. Some people have more calcium in their saliva, so they form tartar buildup more quickly. The plaque, the biofilm of bacteria on your teeth can calcify maybe more quickly for you than for another person. So it's important to ask those questions to your hygienist and create a plan that's specifically for you, for your needs.
And especially diabetic patients, right?
Yes.
Because they have a tendency of building up more. They have all the sugar already in their blood. That's what we use in the lab to grow bacteria, sugar and blood.
Yes, absolutely. And especially in the mouth, without getting into the details, but the immune system for diabetics, especially if the blood sugar is not controlled that well, the immune system in the mouth is much weaker in diabetics.
Right.
So that's why you get a lot of gum disease, also cavities and dry mouth sometimes, but especially gum disease, I noticed, yes.
Right. And once you start growing that bacteria, what people tend to neglect, and there had been already study published outside of dentistry, where the bacteria tend, as you brush your teeth and eat your food, those bacteria go into your bloodstream and go around your heart, and it can give you heart problem like a heart attack or angina or something like that, because the overgrowth of bacteria being absorbed into the system. So it becomes a systemic problem, even though it's your mouth.
Absolutely.
The beauty is that it's covered by most insurance that cover dentistry. Your hygienist is free for superficial cleaning. And people don't take advantage of that.
Exactly. A lot of people wait until they need a deeper cleaning, and also, like you said, there's a lot of health complications, notably heart problems. So, if you need a deep cleaning, you need to start with the deep cleaning first before it gets out of hand.
Exactly.
Because like you mentioned, the bacteria can infiltrate underneath your gums, whether it's from a cavity that reach the pulp. So some people need a root canal, but they postpone it. That's also not good. The bacteria can go from within your tooth. It's like an open wound, basically. When you have a broken tooth or a tooth with a cavity and the nerve is exposed, there's also a blood vessel inside your tooth. The bacteria can go inside and spread throughout your body. So it's absolutely true. It's like having an open wound and doing nothing about it.
Right.
Right.
You
So
let it go. It's get deeper and deeper.
exactly.
And then you end up losing your teeth.
Exactly. And having medical complications possibly. So yeah.
And those are the patients that we cannot even put an implant now, because if it's really bad with an abscess, infection, an implant is a foreign body.
Yes.
So we cannot even touch it. So, try to, work with your hygienist, because whatever care you're going to need with your mouth is going to be a better transition, much smoother. And the previous half hour, we talked about digestion. So here we're talking about how to maintain. So if you imagine, if you have your teeth, how much pressure you are able to produce to bite on a piece of meat or a corn or any of the food content you're going to use for, to maintain your health. And once, even if you become a dentalist, you lose all your teeth and you put just dentures, the bite go from around 400 down to about 5 or 10. The power, how much power you can produce in there. And that decrease means that when you are trying to bite on that piece of meat, before you can buy with 400 pounds, now you can just buy with 5 pounds per, PSI, right?
Yes, PSI.
So, it's how important. And then, God forbid, you have to have denture. Our staff, our dentists, they are, so cutting edge that they will even do dental implants. We can do permanent, or we can do the snap-on, snap-off, the removable implant for the patient. And that depends on what's the structure of the mouth, how well the bridge of that mouth have been preserved. That's what's going to determine if the person will qualify for. Am I correct?
Yes, exactly. And as far as the one that are snap-on or the ones that cannot be removed, it also depends on the personal preference. Some people like to feel like it's their real teeth.
Right.
So there's a psychological component to
Right.
it. Some people don't want to have to take them off, even if it allows you to clean them.
Right.
Being able to remove them, which is a good thing. But some people just like to have their teeth, as if it was their real teeth.
Right.
So that's also an option. Yes, it's the most popular option, actually.
And that's why it's so important that you guys are so aggressive with bone grafting and all of that, because every time the person have to have an extraction, for the future, you are preserving that bridge around the mouth so that if they ever need anything, there's no empty spot there.
Yes, absolutely. Without bone, we can't do much. We're much more limited when it comes to options later down the road with implants, whether it's for a few teeth missing or for the full mouth. Yes, without bone. And like you said, the sooner after the extraction, the better. Obviously, if there's an infection, we're not going to put the bone right away, but within the next few months, as soon as the infection is taken care of. So the sooner after the extraction, the more likely that bone is to stay.
Okay.
Yes.
Excellent.
I have a question.
Go ahead.
If a little kid falls down and break the tooth, till what age usually we have to wait to, I don't know, make an implant, to put an implant there? Do they have to be at age of 18, 21?
That's a good question.
Yes, it depends also. The biological age is not the most important thing. Your dentist has to assess basically, not the chronological age, the biological age, meaning if the bone is done growing. So if it's in the maxillary or the mandibular, it has to be, x-rays have to be taken and to see if the teeth are done coming out, including the wisdom teeth, because at that age they can still make things, move a little bit around in the mouth. But depending on the case, yes, an implant can be put maybe around 18 years old. And then if it's not possible, your dentist can advise you to choose another option. Usually the bridge is another option if the implant is not possible. But a lot of the time the implant is possible, yes, especially at that age.
Right,
when there's still a lot of bone and
Yeah.
yes.
And if it's a baby tooth, then you just let it be because the other one is coming behind.
Yes, then there's
On
no
the way.
implant, obviously, to
But
replace it.
I'm so proud of what the creation of AGI, because I saw Nicole's daughter,
Yeah.
and she's what? How old is she?
She's like 4.
like 4 years old.
4, 5 years.
And she has a medical condition that this is the younger person that we have done denture for. And being 4 years old, she has
Yes.
a full mouth of denture, upper and lower, with extracted all her teeth because she was, losing her teeth. So a 4-year-old, she has a beautiful smile. now.
Beautiful smile, yes.
And, the psychological impact that we are producing on this 4-year-old, it made every investment I have done for AGI, all my effort, it's when I saw that little girl, I say, thank you, God, for allowing me to take this path. Our guest had been Dr. Massi Benzid, one of our wonderful dentists, highly trained available to work with you in your needs, and with his full staff in the dental department. Remember to give us a call, and we are open on Saturday. You can request any of the dentists by their name or their profession, or you can see just one of the general dentists, and we will make sure that we will triage your situation and send you with the proper person that's going to take the best care of you. AGI is located in Fort Lauderdale and Boynton Beach, and you can visit our website at www.agifl.com.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.